Hello, everybody. We are going to just give it a couple seconds here while everybody starts joining us from the waiting room. All right, looks like we have most people starting to join from the waiting room. Well, good afternoon, everyone. Thank you for joining us today for our April BRI Care Consultation Learning Collaborative. And today we have members from our BRI Care Consultation team with us to talk about effective strategies for recruiting and engaging family and friend caregivers, as well as people living with dementia into evidence-based dementia care programs, including recruitment for the CMS guide model. So as you probably heard from the announcement, today's webinar will be recorded, and the recording and the accompanying PowerPoint slides will be available after the presentation and can be found in our resource library on our website, which we have linked in the chat for you. And then throughout the presentation, please feel free to submit your questions using the Q&A or chat features at the bottom of your screen. That will be answered during the Q&A portion of today's webinar, along with some of the questions that you all have already submitted during the registration process. So with that, I'm all going to go ahead and I'm happy to introduce our two speakers today, Michelle Palmer and Lori Scharf. Michelle is the Sales and Marketing Associate for Benjamin Rose. Her primary focus is to generate awareness and extend the research of evidence-based programs developed by the organization, and to match these programs with appropriate community-based social service organizations across the country. Over the course of her 30-year marketing and communications career, Michelle has helped manufacturing, technology, and nonprofit organizations establish a lasting presence in the new markets through strong content creation, developing strategic marketing campaigns, and initiating business alliances. Our second presenter is Lori Scharf. Lori is lead care consultant and master trainer for BRI Care Consultation at Benjamin Rose. She has more than 19 years experience working with older adults in the field of aging. Prior to joining Benjamin Rose, she was the support services manager for the Alzheimer's Association Cleveland area chapter, delivering caregiver support programs, providing programming for individuals with early stages of dementia, and late stage programs for caregivers. Through her work as a residents' right advocate and long-term care ombudsman, Lori has helped to develop and implement trainings to nursing home staff on creating and delivering person-centered care. So with that, I will go ahead and pass it to Michelle to get us started.
Thank you, Morgan, and thank you everyone for joining us today. We are here I'm going to start out talking about marketing materials, messaging, recruiting, and outreach, which is a huge subject. So I'm going to try and narrow it down as much as I possibly can and talk realistically and practically about some marketing programs and techniques that we use here at Benjamin Rose. So specifically, I'm going to use BRI Care Consultation as our sample program. That is our evidence-based care navigation program here at Benjamin Rose. But hopefully the concepts that I'm talking about should apply to pretty much all of your programming. So just to be clear, because we're going to be using the terminology, we are also a delivery organization for BRI Care Consultation. And as we do that, we call the program We Care Because You Do. So I'm actually actively involved in helping to market that to caregiver audiences as well. And then finally, we are also really actively involved in partnering with health care organizations to deliver the care navigation components of Guide. So we're also starting to get involved in generating the outreach materials in campaigns that hopefully will draw eligible Guide participants to that program. So I'm going to share with you some of our experiences in our marketing efforts, and hopefully there will be some things that you hear that resonate. I am absolutely not here to tell you this is the way to do it, far from it. But these are some of the ways we approach recruiting, awareness, and outreach for our program. Slide. Thanks. So why do we struggle so much to market our programs? Well, quite honestly, it's very hard. I've been in this business for over 30 years, and I've been in a lot of different industries. And this industry is tough, let me tell you. Basically, we're looking at marketing our outreach. You're basically at any one time always looking at reaching the right audience at the time that's right for them, when they're in the right place to hear the message. And it needs to be the right message that resonates with them. So, I mean, it's pretty much a perfect storm. This industry is difficult because it's not just, hey, let's put out a flyer and market our product. There's a lot of education involved with this. So as we all know, the people that we're talking to, caregivers, tend not to know their caregivers. So there's first that. They need to say, oh, wait, hey, I identify with this. Second, a lot of them don't really understand that there are programs out there for them. So the first two things we're doing is pretty much educating. And that's before we can tell them all the wonderful things about our program and what it's going to do for them. So it's a process. It's not a one and done kind of thing at all. And then finally, marketing is probably not your job. I'm betting there are very few people on the call with marketing degrees. But you're doing your marketing because you work for a nonprofit, and we all wear a lot of hats. So don't beat yourselves up. It's difficult. Next slide, please. Okay, so when people think of marketing, most people go immediately to materials, flyers, brochures, marketing collateral. And it is very true that you need them. People need to be able to read about your program or your organization. They need to get your program details and get your contact information. So yes, you absolutely need collateral. And yes, it definitely should be nice and colorful and is professionally designed as you can make it. However, there are lots of different kinds of materials for different applications. And cost effective is pretty important for most of us. So as far as format goes, there's the traditional trifold pocket brochure that most of us think of when we think of brochures. And they're great because they're easy for people to pick up. They're easy to put in their purses. They're pretty to look at. They convey the information, and they're actually pretty inexpensive to produce once they're designed. You can usually print like, 1,500 of them for $300 or $400, which is great. However, the downside of trifolds is that you do have to usually have them professionally printed, which means you can't make any changes on them until you run out and reprint them. They're also not the right format to email to people who are asking about information online, which, as we know, is more and more prevalent. So we do some trifolds here, but primarily we do single-sided or double-sided 8.5 by 11 flyers. We do it because they can be produced in-house, cost effectively, and they can be emailed in PDF format. And those are typically what we take to trade shows and conferences. For giveaways at other locations, we do what are called rat cards, which are kind of the size of a trifold brochure, but it's just basically like a piece of light cardstock and printed front and back, which we can also do in-house, or half sheets, where you can just kind of do two up on your copier and cut them in half. We do it for cost reasons, but the real reason we do it is it allows us to change our materials on a regular basis. You can modify the content, the headline, the photos, to specifically match the wants and needs of your audience. So if you're doing a dementia-specific presentation or going to a dementia-specific program, you can change it before you go and print out materials that more directly match the exact needs of your audience. Okay, slide. So that brings us to messaging. So we'll talk about this for a minute, and then I'm going to show you some examples of what we do and how we approach it. First thing to know, there's no silver bullet. There's no magic message. There's no that's going to grab everybody's attention and bring them to your doorstep. It's trial and error, and it's like we said before, it's the right time, the right place, right audience, right message. So you got to try different things. It's not again, not a one and done kind of a thing. The messaging needs to really try to anticipate your audience's needs. People read things with a what's in it for me attitude. We don't even know we're doing it, but we all do it. Every time we hear some information, whether it's a news story or an advertisement, we think how it affects us and what it does for us. So the first rule here is to talk about what they want or need rather than yourself or your program. Talk about what they will get out of things. You'll feel less stressed. You'll provide better care. You'll get the services you need. Kind of messaging. And it's hard because it's way easier and a lot more comfortable to just talk about our program and what it delivers. So the way I find to do this is I talk to our care navigators, because I don't have a lot of client contact, so I'm not exactly certain what the biggest needs are. So I'm always bothering Lori with questions about what people want or need, what are the most common requests, what are the frequently asked questions, the basic needs from caregivers, and then I really try to feature those elements in my written pieces so it resonates with what people are actually out there looking for. So I'm going to show you a couple examples now. Okay, so this, and this is actually designed in Word because I'm not a designer. But the idea is for other people to be able, this I designed for our BRI Care Consultation site, so they can put in their organization name and their contact information. But Lori tells me that when people call, they don't typically call and say, hey, I need help. They have questions. They have specific questions. And so why not go right to them and say, hey, if you're caring for an older adult, you have questions and we have answers. And then when the subhead here, we say, ask us as many questions as you want. We want them to call us. We want to get them on the phone. We want to get them engaged. So telling them, yes, we can answer those questions for you is what, we believe is a nice way to get them engaged and on the phone. And then here in this column, the purple column is where I talk about the actual services and the resources that they ask about the most. So for us, they ask a lot about transportation, a lot about meals. A lot of people are looking for home care help, legal and financial guidance. So I just kind of list them there as bullet points to let them know, okay, these are the kind of questions you can get answered. Next slide, Molly. So this is basically the same kind of thing, the same purple column with the call outs of the answers. But here we're trying to appeal to the caregiver who feels they're not doing necessarily the best job. A lot of caregivers out there do not have confidence in their skills, and they are concerned that they're doing a good job, and they're allowing their older loved ones to age with the grace and dignity that they would like. So this one is basically the same. It just kind of speaks to that concept. Next, Molly. So this is a half sheet that we did, and it's basically the same. If you're caring for an older adult, you want the best for them, but you have questions, concerns, challenges. But this one is obvious. It goes to the stress. It goes to the you're overwhelmed. Wouldn't it be nice to take a few things off your plate? So the messaging is the same, but we use the photo, the visual, and the headline to get across. Yeah, you're not alone. A lot of people have, the issues, are facing the issues that you're facing. It's okay, and we can help you. Next slide. And then here's something that we've started doing lately. I really like it. I'm not positive it's going to be that effective, but we're trying to take the idea that a lot of the issues that family caregivers have is that the relationship with their loved one, especially if it's a parent, changes so much. And it just becomes stressful, and it just becomes, they become the parent, the role reversal kind of thing. So what we're trying to say is, you know what, when caregiving is less stressful, there's room for fun. And you can still be, there's room for you to still be you. So it shows them here baking, kind of a thing that's the result of this program. If you take part in this program, that's one of the results of it. And next slide, Molly. And that's basically the same one. We just did that. That was actually an email blast that we did. Caring for an older loved one doesn't have to be so stressful. And with the visuals, it shows that, hey, we're happy, and hey, we can, we're actually having fun, and we can help that happen. Okay, slide. So with regard to guide specific messaging, it's still very new. And it's still very difficult to let clients know to let people know that that guide is out there. Um, so we talk about the program a little bit, but with guide, we're using a little bit of a different technique because 99% of consumers out there certainly haven't heard of it. And a lot of medical professionals haven't really heard of it, or they've heard of it, but they really don't know that much about it. So what we're doing first is stressing that it's a program from Medicare, and certainly not a scam, because when you hear things free, they're offered free these days, it certainly can sound like a scam. So put Medicare right up front, stress the real benefits of guide. And what we're hearing, the real benefits are the clinical assessment, the access to specialists, the care navigation that facilitates finding resources and supports, and of course, the biggie is the respite dollars. So what we're also trying to do is encourage everyone to check their guide eligibility and not try to weed them out before they call us. Because if they don't qualify, chances are, maybe you can enroll them in another one of your programs. So on the next slide is an example of one of our consumer guide flyers. So need help managing dementia, right up front. It's like, yes. Medicare's new guide program right up front provides you extra care and support at no cost to you. So the headline pretty much says it all. It's not a scam. It is from Medicare. It's at no cost to you. And then we use the body of the flyer to talk about the very specifics. Here's what you're actually going to get from it. Okay. Let's move on to one of the biggies that I really want to talk about is referral relationships. And that is the number one, unfortunately, the number one best way for you to, for outreach and to get a consistent flow of new clients to your organization. It's very productive, it can be consistent, and it can be very, very stable. It's sort of like, you're getting your message out there to people without going to a mass audience and hoping you're reaching the right people and that they're seeing their message. With referral relationships, you are talking to people who already can and could and should be your clients because they're in the places that they already go. The good thing about referrals is that new clients can also be directed to any of your programs that fit their needs. So, they're referred for your caregiver support program. They can certainly then be directed to other programs as your intake person sees fit. Slide. So, who should you approach? There's lots of people, and I'm sure this isn't, I'm sure new to you, but any of these kind of places, adult day centers, assisted living, caregiver support groups, AAAs. If you're not already a AAA, they are phenomenal resources because they have such wonderful and widespread programming already. Any sort of dementia or Alzheimer's specific home delivered meals programs, silver sneakers kind of programs. And then the absolute best holy grail places to go would be health systems, medical facilities, neurology centers, geriatric centers within your hospital system, because they are dealing with older adults all the time. They're dealing with people with chronic illnesses and chronic conditions. And they very likely are also dealing with a family caregiver. So they are in the perfect position to recognize people that would benefit from help. Slide. So there's lots of variables to the referral process. It can work in a couple different ways. So it can be as simple as someone at the facility handing someone your brochure, or at the very least displaying your brochure on the counter. They are at least making your program visible, and in any case, there's an implied endorsement to them providing the information. They're telling these people who already trust them, hey, here's a good program for you. You can also look at having mutual relationships where you promote their organization to your clients. Sending clients to them is a great way of encouraging them to send people back to you. Hopefully the partnership will include dialogue about your program between the health professional or the services professional and the client. ideally, you'd want the medical or services professional to tell the older adult or the caregiver about your program to help get them interested in it, in addition to providing the information. The absolute best way to have this happen is to have the professional provide you with the potential client's contact information. So, because we all know chances are slim that when someone walks out of, someplace with a flyer, they have the best intentions to call, but more often than not, it's going to slip right off their to-do list. Care navigators and social workers and intake people are very well equipped to talk to these caregivers and help them figure out what programs and resources are right for them. So that Lori's going to talk about that in more detail in a couple of minutes. So it's much better if you can get the ball in your court and be the one to do the outreach back to them. Slide. I do just want to say that establishing an effective relationship can be a really long process. And it varies based on the type of venue. So like if you're going to a doctor's office, sometimes you can just talk to the receptionist or to the office manager. If you're going to a senior center adult day program, you can maybe just go and get to know the program director. You can offer them lunch and learns. You can host a Q&A with their members, invite their members to attend an event that you're hosting, anything to kind of get their attention. Slide, Molly. But for health organizations, you can expect it to be a fairly long process. You may start with a mail letter. You might follow up with an email. You might follow that up with a phone call, all in the hope of getting an in-person meeting. You can't expect things to happen overnight with the health center. There could be pushbacks and more meetings and approvals that they need to get. So I'm going to say that we Care currently have 30 to 40 different referral partners. Of those referral partners, some give us one client a month, one client a quarter, and that's okay because it's great that we are the resource out there for them to provide that patient or client with. We have our most productive referral relationship is with a major hospital system here. And I'm going to tell you, it took 4 years to get that up and running. It was well worth it because today the doctors and nurses in the geriatric department there send us probably a dozen referrals a week. It's a lot, and they actually send the names to us, and we do the follow-up. Plus, we actually have care navigators embedded on site there 2 days a week. So that's the jackpot we're all looking for. So, I mean, it takes a while, but it's absolutely worthwhile for your program and for your organization. So I'm just going to give you one other real quick example of a great referral partnership that we have just established with a home health agency. So getting your materials, getting a home health agency or a home delivered meals program to deliver your information to their clients is wonderful because they're speaking directly to the people that are potential clients of yours, but they get a lot of requests to do that. So we kind of put a spin on ours recently. So we worked with a local franchise of a major home health agency, and we took our product brochure, our We Care product brochure, and we actually put in that brochure, we printed a typed paragraph from their president. And the president says what she's doing is offering our program to their clients free of charge. So our program is free in certain geographic areas, as I'm sure most of yours are too. So we just put the spin on it so that she's taking credit. The organization is taking credit for saying, hey, have you heard about this great We Care program? We're pleased to offer it for you for free because you're a valued client of ours. So, I mean, you can't get, it's a win-win-win on that one. Their clients are getting the free service. We're getting the distribution into the place that we ordinarily wouldn't. We're getting the implied endorsement, and then they look like the hero for offering the program to their clients. Okay, one more slide, Molly. So the last thing I'm going to talk about is digital advertising. And then specifically, I'm going to talk about search advertising. So what we're talking about here is when you go to Google and you type a keyword into the search or a phrase or whatever, like dementia, getting help with dementia or respite services or whatever you're looking for. And then the list of results comes up on the left side with a headline or two of description. So those are what are called the ads. And then some, like the one at the second one, A Place for Mom, says sponsored, which means that someone actually paid to be visible and get their ad visible at the top of the page. So the great thing about this form of advertising is that you are talking to people who are actively seeking a solution to your problem that you are probably able to solve for them. So the chances of them clicking on your ad, following up and contacting you, filling out your form, requesting information, or whatever your ask is pretty likely. The way the pricing works on digital advertising, on search advertising, is that you only pay when someone clicks your ad. So it would probably, your ad might be displayed a couple hundred times a day. You can go to the next slide, Molly. But you only pay when someone actually clicks on it and actually goes to your website. So that's pretty cool. They charge a cost per click fee, and that varies on how competitive the search term is. The other key feature of Google advertising is you set your own budget and geography. So you can say, I just want to be in this state, in this county, in these zip codes, and I only want to spend $25 a day. So you are able to set that and completely control how much you're spending. So what you can do is start with a very limited low-cost campaign, see how it goes, and then increase if your number of inquiries or the quality of inquiries you get increases. So next slide, Molly. A lot of people don't know that Google has an AdWords grant program for nonprofits, and it is absolutely free. It's a very simple application. They will give nonprofits up to $10,000 a month in free search advertising. You can use it for all your programs and services, and it is really a phenomenal opportunity. Over 13% of all the Benjamin Rose website traffic comes from our Google grant. However, just want to make you aware, there is a caveat to any kind of Google advertising, whether it's the free advertising or a paid digital campaign. You do need a specialist or an agency to administer it. It's really, really complicated now to manage these campaigns, and us mere mortals really can't possibly do it. So Google, if you get a free grant with them, they actually hook you up with agencies that specialize in running the free Google campaigns. And they can charge anywhere from like $250 to $700 a month to manage your campaign, depending on the size of it. Or you can find someone local, an independent guy that specializes in SEO. But for the quantity and quality of prospects it sends your way, if you have any sort of budget at all to spend on advertising, my personal recommendation is digital search advertising. So that is it for me. Like Morgan said, we'll send everybody a follow-up email that will include the webinar recording. I actually have created a booklet called the Key to Successful Referral Guides, and I'll include a link to that if you're interested in downloading it from the reply email. And I hope there were a few helpful morsels in here for you today. So thanks very much. And I'm happy now to turn it over to Lori. You're muted.
Thank you. I realize that. Thank you very much, Michelle. Next slide, Molly. So I feel like I'm the Debbie Downer following Michelle, because she said there's no silver bullet. And I think of Field of Dreams, if you build it, the question is, will they come? You have your organization positioned to provide services and supports to clients. Programs are in place to be delivered that promote your mission. You are presented with great marketing tools and information, as Michelle gave us. We have our field of dreams, but it's also helpful to have the next conversation. Next slide, please, Molly. So again, this is the perfect storm. we're talking about CMS guide. We're talking about that it's support for caregivers. There is $2,500 in respite care that you get to remain in the community. It's like, how would people not be beating down our doors in order to be able to access the service? But we all find that this is a challenge for us. Next slide, please. And so let's understand the caregivers that are coming to us. The caregivers have needs, they have barriers, and they have strengths that are there. That caregivers, for one thing, it's the word caregiver. As I noticed in one of the questions, no one thinks of themselves as a caregiver. They think a caregiver is someone who's trained, a professional, somebody who gets paid. I'm not that caregiver. I'm just a person on the other end of the phone, kind of making this call. So it starts with meeting the caller as an individual rather than as a label, much like we talk about the person rather than the diagnosis that they may have. The caller's primary focus is on an immediate need. I need respite. I need something that's out there. And something has changed. And maybe nothing has changed, but I just can't, live another day in this situation. The caller is looking for a quick answer, program or information that will change or subdue the present. But there are barriers that they encounter that some we know about and some we don't. Caregivers, if we understand them, are juggling many tasks, medical appointments, finances, running a household. So we understand why they are hoping for that quick fix. Having to ask for help or accept help may be self-deprecating and a big first step for the individual. But fortunately, the caregiver also brings strengths that we can identify and reinforce because face it, too many times people feel free to tell someone what they are doing wrong and think they're being helpful. And the last piece about caregivers and understanding them is they're looking for help, but not sure what they need. They know what questions to, knowing what questions to ask is important, but how do you know what the right questions are? So care navigators need to listen and lead the discussion on what's going to happen. Next slide, please. So we look at, so how do we do all of this? And a great starting point is the social determinants of health. These are non-medical factors that influence health outcomes, encompassing the conditions in which people are born, grow, live, work, and age. It's an organic and eclectic approach that both the healthcare and community slide use to have richer conversations about needs. BRI Care Consultation assessments tap into the very elements that social determinants of health are talking about. You can see that we have 35 domains. Some of them are specific to the care receiver. Some of them are specific to the caregiver. It's important that we understand the caregiver is an important player in this whole process. BRI Care Consultation is not a clinical assessment, but a conversation that builds relationship while addressing the overall situation. Next slide, please. But what about these barriers? There are many barriers in terms of what the caregiver is faced with. Where do I go? What questions do I ask? You know, filling out the forms, waiting for someone to return a call. You're put on hold and you have to make an appointment. What's the eligibility criteria that's there? And where do I find the time? There's also one of the biggest challenge is um, what we do with caregivers is we expect them to have this technology guru and being able to access the information as easily as we do. And that's not always the case, especially for our older caregivers. I spoke with a caregiver who had received information by text from a social worker, and he wasn't able, it was an attachment. He wasn't able to open up the attachment. Sure, texting is a wonderful thing, but you have to know your audience. You have to know what the adult learning style is of the individual that you're trying to give this information to. And another big barrier is the resistance to asking for help. Because if you ask for help, that means there might be change. And caregivers have this fear of change. They have they fear that someone's going to have a loss of decision making, that they have this unknown fear of maybe death. So there are many pieces that contribute to, you know, how do I work as a care navigator? What do I do? But it's not a hopeless situation. Next slide, please. So let's look at the caregiver concerns. The caregiver is not coming to the party, so to speak, with just one of these concerns, but they are juggling their own physical health. They have their own health concerns that may have been impacted by the stress of caregiving. They they don't feel that they have time or are worth having, talking about self-care for them. Their primary concern is about care needs and, the eligibility, what is person-centered, home versus facility, what that looks like. And caregiving is about decisions and how can they make good decisions. And so you've got these two factors going. It's kind of like bubbling, the pot's starting to bubble. And then we have behavior change that comes with, especially with dementia, that the person that they're caring for may have outbursts, they may have anxiety, or they may be resistant to accepting help. It's not consistent, and managing the situation can become like, herding cats, as they say. And the last piece is the emotional health. Caregivers feel isolated. They have family and friends who say, "Oh, just ask me, you know, uh, let me know what I can do," but they don't come through. They're not able to. There's misplaced anger, and there's the loss of relationship that caregivers feel, the relationship that they had with the person they're caring for, loss of, what our retirement time age is going to look like. And there's also that ambiguous grief, the mourning, the death, so to speak, of their loved one who is still there, who is still physically present, but they're not mentally and emotionally present. Next slide, please. But one of the greatest assets we need to consider is caregivers bring strength. They have empathy and compassion. They have effective communication. They have some problem-solving skills. As a care consultant, I will throw options and ideas out there. And I always tell caregivers, don't be afraid to tell me, no, that's not going to work. You're not going to hurt my feelings. But many times in having these conversations, what I do is it stimulates the caregiver to think of some way that might work. Empathy and compassion, a natural ability to understand and share the feelings of the person they are caring for. They have patience and understanding. And granted, I will admit at times patience and understanding can be very limited, but they show respect for the person they're caring for at the end of the day. Having strong communication skills to interact with patients, family members, and healthcare providers, so everybody's speaking the same language and on the same page. The physical stamina and strength, that is something that caregivers, bring to the table every day. I am amazed at the caregivers that I hear their stories and the challenges that are going on, and they might have their own health conditions. I'm amazed that they put their feet on the floor every morning and get out of bed, because I think I would just hide under the blankets. Time management, many caregivers have become very effective in doing this, and problem solving and critical thinking skills. They have to try to stay one step ahead of the person they're caring for. Next slide, please. So how do we know if a caregiver is ready to accept help? And there are some different solutions and options that are out there. So there is a caregiver assessment questionnaire that you may want to have the caregiver fill out, or you may want to kind of, in the course of the conversation, bring some of these questions out to understand where they're at and if they're recognizing that they may need a little bit more help that they're thinking about. Next step, please. Next slide, please. So how do we create caregiver buy-in? How do we get all of these different connectors that are out there, these balls that we're juggling, how do we get them all to kind of stay up in the air at the same time and even in a set pattern? So what we want to do is we want to, as a care navigator, we want to build rapport with someone. We want to be able to have that conversation, to ask them how their day is. How are you doing is an important piece. We want to have reciprocal communication. If we're just asking yes and no questions instead of open-ended questions, it makes it very challenging in order to be able to see where they're at and what's going on. We want to foster the caregiver knowledge. What have you tried? What has worked? A very simple one is, tell me about your loved one. What did they used to do? What were the things that were important to them? And using those pieces in order to create the buy-in and empowerment of the caregiver that's there. Awareness of the progress. Many times the caregivers are so steeped into the middle of the whole situation, the only light they see, they think is the light that's a train coming at them. So kind of reminding them, well, look what you have completed so far. You've attacked this problem. You've been able to get this service in place. I've been doing so much, and sometimes um, let's bask in the success of what they do. And caregiver support and coaching. It's we're not the person that's telling them what to do. We're not the sage on the stage, but we are the guide on the side that's helping them. And in a collaborative partnership, you want to present yourself as a collaborator partner rather than the authority figure that's there. You want to really include them in shared decision making, because if you make the decision and you tell the caregiver what to do, if it fails, it's your fault and you lose credibility. However, if you have this, talk about what the next steps might look like, and if you did this, what could happen, you're having that partnership that's so important to anyone. And we want to do is we want to um, respect the expertise and the knowledge and experience that the caregiver brings about their loved one, about the situation, about their family values, and what's important to the person that they're caring for. Next slide, please. So what we want to do is we want to get connected to resources. So Michelle gave us some great marketing tools and tips that are there. But as part of this process, I like to think of this as a four-step dance. As you work with clients, continually assess and prepare for changes. Pivot may be your mantra that helps to adapt and adjust. Provide disease education, caregiving tips, and other helpful tips during the call, followed by reinforcing the subject with the resource support. So what that means is I like to use education. I used to talk about the disease, talk about some caregiving tips, and then I like to reinforce that by providing them maybe a video, maybe a short something to read about caregiving tips. And then I'm going to reinforce it during our next conversation. Did you have a chance to read this? Let's pick out one of the tips that you read about that you think is going to work. Those ongoing contacts are that opportunity to really check on the progress, to identify the barriers. I was going to go to the caregiver support meeting, but my hot water tank blew and I had to wait for the plumber to come and I missed it all completely. And so what I want to do is, let's plan what the next steps look like. But we're not just providing materials that are there. What we're doing is, you know, it's not a siloed read it and we don't talk about it again. It's like, let's put that into place. So as a care navigator, you're facilitating the connection to organizations, to specific programs, and you're finding that contact person to help create that connection for the caregiver. You're making it easier for them to be successful. Next slide, please. So Michelle had all of these, these great pieces about partnerships and what that looks like. Identify partnerships and resources at the local, state, and national level. When it comes to some specific diseases like Lewy body disease or frontal temporal dementia, there are some national sites that provide great resources. So as a care navigator, become familiar with all of these pieces. Look at the community organizations, see what their programs that they are delivering, and maybe find some gaps or unmet needs that you can provide to their clients. It's making them look good at the same time you're providing a service. Look at programs that align with Guide, that support the individual that's there, and understand that maybe finding again those needs that aren't being addressed. And what you want to look at also is the outreach. You want to understand the program that you are referring the caregiver to. You want to create like referral packets and a referral process so that when the caregiver contacts them, they're going to get right to the front of the line almost because they know what they need. They have some eligibility criteria all in place, and they don't have to wait for a second and third phone call. And we want to offer opportunities for resources and training and communication, as Michelle said. She talked about the lunch and learns. Those are pieces that we want to, we want to be of value and service to the referred agency that we're working with. Next slide, please. So working with partners. So, again, you can create all of these great have these marketing materials ready to go. But from your end as an organization, in order to recruit caregivers, you need to have a smooth process. What you want to do is design what you want this process to look like. Do you want them to email you? Do you want a phone referral? Maybe there's a referral platform that both of you use that you can use that. Um, Maybe there's a referral form that you've designed in order to facilitate the process. Have your ducks in a row before you do this outreach. And then what we have found in working with the hospital system that we worked with, uh, it was a process because they were providing us with the information on the patient who had dementia and giving us their contact information. And if you're trying to call someone with dementia, they're either not answering the phone or they're not remembering, what that looks like. So we had to go back and say, we really need information about the caregiver. We need their name and contact information because that's the person who we're going to work through most of the time. We want to know what their relationship is to them. That can be helpful. Yes, we want to know the patient's name, and we want to confirm if they are part of Guide. Have they been assessed? Are they approved? Are they waiting to be approved? Where they are in the whole process. Another important piece is, who is this referral going to? We don't want just the general mailbox or the general phone number. It's really helpful to have a specific person and an email that in case there is a hiccup in the whole system, that I, as the care navigator, I can call them up and say, hey, did this person reach out to you? Were you able to connect with them? How can we work together with this person? And we all want to be acknowledged. So an important piece in that relationship with the referral partners is to acknowledge that thank you for the referral that you sent for Miss Smith. We will be reaching out to you. We reached out to Miss Smith, and as a result, we have her enrolled in the program, and she's ready to go. We want to provide feedback. Miss Smith wasn't quite ready to enroll in our program, but perhaps the next time you have a conversation with her, you might, kind of talk up our program a little bit, or share with her that we are collaborating together. Also consider that you might want to monthly or quarterly just send something out to your referral partner saying, we've been working together, we've had this many referrals this quarter, and we were able to enroll this many, 60% of the folks into the program. So those are pieces that we want to, think about. Next slide, please. The biggest challenge is, what if you have a client that's not eligible or becomes ineligible? We know for GUIDE, if someone enters a nursing home or is on hospice, they're no longer eligible. So it's important that, yes, we can't be everything to every person, but we want to acknowledge their role as a caregiver. We want to provide the reason why they might be ineligible. But at the end of the day, we want to be that super INR, that we're going to provide them alternatives or referrals to other organizations in order for them to be able to meet their needs. Thank you very much.
Wonderful. Thank you, Michelle and Lori, sorry, and Molly for advancing slides. So we're now going to move to our Q&A portion of the webinar today. So make sure if you haven't already put some of your questions into either the chat feature or the Q&A feature that you do that now. We have a handful of questions to get us started here. And I'm actually going to start with one that came in through the Q&A that Michelle provided an answer to, but just in case, so you can speak maybe a little bit more about it, Michelle. But the question is if we provide marketing materials for BRI Care Consultation that can be shared with caregivers, and if so, are we allowed to add our own agency's information to the flyer?
Yes, absolutely. We have an online directory. I think we put it on a Google Drive, where we've created a series of flyers, some of the same ones that we've shown today. And then yeah, so I'm not a designer. I don't have access to design tools, and most people at organizations we deal with don't either. So I actually designed them in Word. And I left blanks in there for you to put your organization name and your contact info. So yeah, you are welcome to them, and you're welcome to alter them in any way that you'd like. And if anybody doesn't have access, who is a BRI Care Consultation organization here, just shoot me an email or put yourself in the chat or whatever, and I'll make sure I get you the link tomorrow.
Great. Thank you. And we had a couple of different questions related to advertising and marketing. So I'll funnel these ones to Michelle. What do you think of the use of QR codes in advertising?
I think the more ways that you can get people to your website and to your materials, the better. Absolutely use them. There's some people that still don't, but they absolutely can't hurt. When you send them to the page, if you have the opportunity to direct them to a specific landing page that is designed specifically to receive people who are actively taking that step, and you can you can put ways on there to collect their name, to collect their contact information. That is the key to getting someone on your website or your landing page, is try to get their contact info. So offer them an opportunity to download something that they might want, and put their name and email address in for that. Have them fill out a contact form for more information, for whatever. But yeah, so QR codes are great. And the more chances you get to get their information and contact them back, the better.
Thank you. And there's a similar question that came in with registration that I want to ask you, and that's about how to use social media to reach caregivers.
Yeah, it can be a great outlet if you have strong social media sites, especially, and you have people, the caregivers and care receivers that visit them. That's phenomenal. It's a great site. It's a great way to communicate. Basically, the number one thing that a lot of people don't do is they do a lot of posting and they don't answer. So if you're lucky enough to have someone that is actually commenting on your site, please go out of your way to answer them and start a conversation and get that going. Other than that, the more interesting, short you can make your posts. I'm not telling anybody anything new here. Humor is great. But yeah, I mean, with social media, like with anything else, it has to be interesting. You have to capture their attention. What also is good about it is you can put links in it. So you can send them to your website, to your landing page from there too, if you do happen to get their attention.
And I just want to say that as part of BRI Care Consultation, in addition to the program that we sell and the license and things that and doing the initial training, we provide ongoing support and fidelity sessions, and we have these conversations about recruitment. We have these conversations about marketing that we bring Michelle in, and we continue to support any of our sites so that they can be successful.
Thank you. So the next question, and I think either Michelle or Lori, either of you can talk about this, but one attendee wants to know if you can share more about the script you use when offering guide to your clients.
Um, I don't think there's a script. It's just having that conversation. Tell me what your care needs are. Tell me what a good day looks like. What gets in the way of a good day? Let's see what we can get you connected to in terms of resources. So of course, we're looking to the resources that the AAAs provide, but we're also, as we're asking questions, we're talking about, what is your medical insurance? And if we understand that they're that might qualify, that they have original Medicare and not an Advantage plan, we, now with this opens up the door for additional resources. So it's just kind of friendly and inquisitive. We get to be nosy, as we like to say.
Thank you. Let's see. Another question is, if you're not sure of the what's in it for me for a group, how do you uncover that?
Huh, that's a great question. Not sure I know the answer to that. I think for a specific group, if you don't know, you're just going to have to talk to them and find that out. What we've found is there are a lot of patterns to what the needs are out there. So that's what I said. I talked to Lori, I talked to our caregivers. I read what other people are saying out there and just try to see what seems to resonate the most with people. And yeah, ask the leading questions that Lori just asked. Wish I had a better answer than that, but yeah, that's a tough one.
And then I think I'll send this next question to Lori. Because some caregivers do not self-identify as caregivers, what verbiage do you use to capture this segment of caregivers? What phrases or words cause them to realize that they are indeed a caregiver?
I like to, kind of create these stories and think about relationships. So when you're in a relationship, each of you helps it, 50-50, 100. And then someone gets ill. So maybe somebody's doing 60% of the work and the other person's 40 until they go back to 50-50. And then what happens is 60-40 comes, and then it's 70-30. And before you know it, you're doing 101% and the other person isn't able to. So you slide into this role, and it becomes the dominant role that's there. My goal is to help you recapture being the spouse, the adult child, the brother or sister, as we're finding out that combination is coming to us. But let's get back that relationship that you used to have, and you're not a caregiver first. And I say, what does that sound like? And they'll say, that sounds wonderful.
I'll just add to that. In marketing, we do slip a lot of times and say caregiver because it's just kind of necessary sometimes because we refer to it so much. But we just tend to say if you're caring for an older loved one or an older adult, and try to make it as generic as we possibly can and not provide a label at all.
And we have some people in the chat also mentioning too the word care partner or listing things that caregivers do, assuring them that they are caregivers if they do any of these things regularly.
Yep.
And then I think we'll ask one more question because it's pretty straightforward. If you know it offhand, Michelle, but one attendee wants to know how much are Google Ads? I know you talked about the nonprofit grant program, but I'm not sure if you know off the top of your head the other services.
Well, it's billed by a particular keyword. So some keywords are going to be more competitive than others. So if you take the keyword caregiver or family caregiver or something, that could maybe be $8 to $10 every time that is clicked on. There's others that aren't searched as frequently, and they're going to be $1 or whatever. So it varies based on how many people are actually going to search on what the keyword is, how many people you're going to be looking at. And like I said, you can set your daily limit, so you don't have to worry and say, uh-oh, I better just stick with these far-reaching ones because I don't have that kind of money. You can just cut it off when you hit your budget.
Okay, great. Thank you. Well, we are at time today, so I don't know if Molly, you want to go ahead and go to the next slide. Before we leave, I want to thank you all for attending our April BRI Care Consultation Learning Collaborative, and obviously a special thank you to Michelle and Lori for our presentation today. And we will be putting Michelle's email in the chat if you have any follow-up questions about BRI Care Consultation, or would even like to schedule a one-on-one conversation to talk more about the information presented today, or about how maybe BRI Care Consultation might be a good fit for your organization. And then don't forget to save the date for our next Learning Collaborative, which will be held on Wednesday, May 14th from 3:30 to 4:30 p.m. Eastern Time. We have Esther Kane from the Association for Frontotemporal Degeneration, who will be joining us to talk about the signs and symptoms of frontotemporal dementia, how it's diagnosed, and the specific needs of both those living with frontotemporal dementia and their caregivers, as well as helpful resources and support services that are available. So we have also put the link to register for the next Learning Collaborative in the chat as well. So thank you all again for attending, and we will see you in May.